All right. How you doing there, April?
I'm doing well, Cindy, on this fine Sunday afternoon.
It is a fine Sunday afternoon. I wonder if anybody else besides us people in the Northwest talk about the weather so much. We are seriously obsessed with it all the time. And I wonder if it's because it's the Northwest. And maybe because we appreciate it every single day.
I talk about it because I want to know when I can get out and hike. Now, in my home state of Michigan, it's basically going to be snowing. So
yeah, I'm excited about this episode. I talked with Jill Meyer-Lippert. She is a fellow hygienist who lives in Wisconsin. And we talked about the side effects of cancer. Both her mom and her dad had cancer. So she watched them both go through the side effects of the treatment. And so talking about not so much about the cancer itself, but the side effects. And so she started a business to help dental professionals, but also patients and families, anybody. And it's called Side Effect Support LLC. So she has products that help with think about medications make your mouth super dry. And if you have any caries already that were starting and now you have dry mouth and acidic environment and just the pain and so you're fighting one disease, but then you are growing another one in your mouth. And so we had a really good conversation about that. Patients whose gums get swollen and puffy and how important it is to use like a soft bristle toothbrush. It was very enlightening.
Well, it's great you bring that subject matter up as well, because we'll have another episode that piggybacks on that with a product that helps cancer patients as well, a type of brush post-op surgery for patients with the sore gum tissue.
Yes, because you think about the gum tissues being so swollen and or after surgery, you're not supposed to brush certain areas for a while, but then you get that plaque and the bacteria. So how's it supposed to heal if you have all the bacteria surrounding, and the infection? And yeah, so I'm really excited about the following episode that you're talking about as well. And that's just an amazing product that can help so many people. So that's super exciting and coming up soon.
A segment of the population that certainly needs special implements that are, people are inventing some great products for that part of the population.
Yes, definitely. So I'm really excited for everybody to hear this episode with Jill, and she's got such passion to help people. She's going to talk about that.
Well, excellent. I can't wait to hear it.
Yeah, and one thing she was talking about is because she lives in Wisconsin, and another company she works for, they usually do like a CE course that's something to do with a course crawl, and you have beer and you go to different courses. So I'm like, oh my gosh, that's right up our alley.
What kind of dental ailments can they come up with?
I know, I'm like, we need to be there. Of course, it's canceled this year, but maybe next year. But when she said that, I was like, yeah, we're coming next time.
Yeah, it involves beer
and
more. We could try some on the show out of Wisconsin.
Yes, for sure. Is that where? Is it Milwaukee, Wisconsin? Is that the
Milwaukee?
Beer?
Yeah, and Madison.
I've been to Madison.
Oh, okay.
Yeah. So what beers up there? Is it like 390 or 590 or 5?
Oh gosh,
like area code beer.
The name escapes me at the moment. You caught me. I can see the name. Darn it.
There's Goose. There's Goose Island. I think that was in Chicago.
That's in Chicago.
Okay.
Gosh, what's the one out of Wisconsin? It's highly regarded. Not Gilgamesh. Maybe it's Gilgamesh. Anyway.
Yeah. Well, I want to find out. I'm going to look it up.
Okay. You tell me. It's right at the tip of my tongue.
All right. Well, since we can't figure it out, if you guys know the answer,
right.
Whoever answers it first, please put it down and send it to. Yeah, we'll send you a toothbrush. We'll send you a toothbrush with our name engraved on it. Because we never see those. Yeah. Anyway, if you know the name of the beer in the craft beer in Wisconsin, please chat it out to us. Put it down in any notes, anything you see, and you will be our hero. And we will send you a special gift because we have some special gifts coming up.
That's right.
Watch for those.
I'm looking this up. I can't take it.
I know.
I'm looking at that right now. 608.
608?
That's what you're thinking of.
Oh, okay. I know there was like a number thing. We get spoiled here in the Northwest with culmination and
always culmination.
Yeah. Okay. So yeah, check out this episode. Let's support Jill in her supporting people with side effects from cancer, medications, treatments, and we will put all the information in the show notes so you can find her website. All right, enjoy.
Well, I started my first job in the dental industry in 1992. And almost the exact same time, my mom received a breast cancer diagnosis. And during her chemotherapy, she suffered so badly with side effects, and especially side effects inside of her mouth. And it was very frustrating because when she approached her oncology team to get some guidance of what she could do to relieve the pain that she was in, they were very dismissive of it. They basically just said it was part of her treatments. There was nothing she can do, and left it at that. So she was very frustrated, and I think that is just in my nature. I'm very protective of people, that if I see somebody suffering in some way, I want to take action. So it really just basically, I always say, it lit a fire in me that I wanted to learn more about this. And I really foolishly had thought at the time that, being that I now worked in the dental industry, I thought, well, I'll be able to find out for you. And it was really disheartening to find out that there was no help on that end either. Nobody really knew what to do on either side. So I started to, just out of curiosity, question people in the practice where I was working. And I had everybody who came in with a cancer diagnosis, I would ask what kind of cancer they had and what kind of treatments they had, if they had problems inside of their mouth. And I just started doing this kind of mental list of what I was learning. And I found out that very few people felt like they were adequately prepared from their medical team as far as what they could do to prevent or manage the issues, that they were adequately prepared to know what to expect. And then I found so many people got through their treatments, and they were sometimes years into their survivorship, and they were still spending all this time and money in the dental office trying to repair this damage that was done. So I really just learned that there are so many things that people were finding out, as far as sometimes when they did receive advice from their medical team, it was really bad advice, where they were sometimes told, for just an example, somebody that had a lot of dry mouth issues, which is, really, really common for cancer treatments. They were being told by their oncology team to suck on lemon drops to help relieve that. And it was so shocking to me the first time that I heard that people were being recommended that, but then people might be surprised that that's still a recommendation today for a lot of patients. And there's even some cancer centers that will keep out big bowls of lemon drops or Jolly Ranchers or something like that for their patients to suck on. So there's this focus sometimes on relieving the immediate pain or discomfort issue, but they're not thinking necessarily in long-term oral health and prevention of cavities and infection and all those things that are eventually going to also take its toll on their health. So I found out, though, too, the more that I looked into things, that there's sometimes things that we recommend as dental professionals that also are basically doing the same type of thing. They're masking the problem that's immediately there, but they're contributing to this long-term damage for people. So it was something that I wanted to give patients a resource. And it started out by just creating a volunteer program. So everybody that came to a local oncology department where I live and started their chemotherapy or radiation to the head and neck, they received a very rudimentary goodie bag. It was basically a colored lunch bag that I had stuffed full of product samples and really simple information of side effects that they may encounter, very simple recommendations of things they could do to possibly prevent or manage the problems. And then that way they had something to go home with and start with right away, because it is such a traumatic time for people. They are so stressed, and unless they have something to start with, it just gets lost in the shuffle. So you can recommend certain things, but then they end up just using the same thing they have at home, or if they go to the store, they maybe can find one thing but not the other, and they just go back to what they were using before. So they do benefit by having something they can go home with and start. And I found that after a while, though, the donations that I was getting to stock these kits they're getting smaller and smaller. So eventually I just didn't have enough to keep the kits going. And that's what inspired me to start Side Effect Support, which is an online resource where it not only helps the cancer survivor and their family caregivers to get information and over-the-counter products, but it's also a resource resource for medical professionals and dental professionals to try to get us more on the same page, to bridge that gap of communication. And we can have access to a prescription product and the over-the-counter products. It just is more of a kind of a one-stop shop for them. So you don't have to be searching for all of this information because it's so overwhelming. And I think that it's something that just gets lost in the shuffle. You know, when my dad went through his cancer treatments, I remember him coming home with a 3-ring binder, this really thick binder, and somewhere buried on page 26 was a small paragraph that talked about oral side effects. So the thought that patients are going to, number one, even see it or digest that information or be able to have the wherewithal to follow through on the recommendations, I think is unrealistic. We have to make it more simple for them and get more on the same page with our dental partners, or medical partners, I should say.
Yeah. So you think there's a big disconnect between medical and dental?
Oh, yes.
I think you said both ways, but it seems like it's more like since there's dentists, that they just consider it a completely different aspect in healthcare.
Yes. And unfortunately, some of the problems that people have in their mouths when they're going into cancer treatments, if it's not addressed ahead of time, they're having more poor treatment outcomes. They're having more pain, more infection, less in quality of life. So if we can bridge that gap and be more on the same page and look at oral side effects and oral problems in a more preventive way, we can really help to preserve that quality of life, but also give them better treatment outcomes.
Yeah. And so I know if somebody, let's say somebody's going into the service, or if they're going to have surgery, the patient will come in and have an exam and they want the doctor to sign off that all the treatment is done prior to that. So why don't we do that prior to having cancer treatments as well? Because like you said, they could be fighting an infection in their mouth. Mm-hmm. And then if they're trying to fight cancer on top of that,
exactly,
probably battling for the attention.
Exactly. And unfortunately, I think there is that attitude that, and actually this is a comment that was made to me many times when I had first started Side Effect Support. People would just look at me with this kind of blank stare in their face and say, wow, why in the world would somebody care about their teeth or their mouth when they're dealing with something so serious? And I think that's the flaw in the mindset that we really have to overcome, that they just see this as, okay, somebody has, which obviously it is, it's a life or death diagnosis. It's a change in their entire being, but that doesn't make their oral health any less important when you really connect the dots on what kind of an effect it can have with their treatment process.
Absolutely. Yeah, I could totally see that, thinking or knowing that this cancer is obviously takes precedence. It's so important and so scary, but yeah, you got to stop and think of the whole picture and put everything together for the best results. Did you say your mom and your dad both had cancer?
Yes, my mom had breast cancer and my dad actually had 2 types of cancer. He started out with a really mild form of leukemia called chronic lymphocytic leukemia. And then he eventually developed other medical conditions and then was diagnosed with Hodgkin's disease, which is a type of lymphoma after that. And Hodgkin's is considered a treatable cancer. I guess if you have to get a cancer, that wouldn't be one of the worst ones to get. But his body was already so weakened from his other conditions that the same type of treatment that would save one person was too much for him. And we actually had to make the decision for him, with him, I shouldn't say for him, but with him, we had to decide, are we going to continue the treatments and most likely have the treatments take his life, or would we just discontinue the treatments and let the cancer run its course? And that is, he was suffering so badly with the different side effects of his treatments that was the decision, is basically to just stop and let the cancer do what it was going to do. So I think that in itself too really made me hyper aware to the seriousness of the side effects of treatments.
Yeah, to think that we don't want to do treatment because the side effects are so bad. You see commercials of medications and the list of side effects are so much more than the commercial and the benefits. It's weighing those options. But if we reduce those side effects, then we could have better treatment outcomes. And what are some things that you do to help with the side effects?
One of the biggest things is really, if we can, reaching them as early as possible in the process. And if we look at, what type of cancer they have, what type of treatments they're going to have, we can anticipate what type of side effects they'll be most likely to possibly suffer from. So if we know that ahead of time, we can start addressing them before they even have a chance to start. And that doesn't mean we're going to totally avoid them, but if we can delay the onset and delay or reduce the severity. That's probably the biggest goal. So it's something, sometimes it's just really simple things. I mean, they're so simple, it almost seems ridiculous, but it just gets, it's just something that isn't thought of a lot of times. So it's something as simple as using a compact head extra soft toothbrush. As you know, you send your patients out to the store and they usually come home with these huge, I always say it's like the size of a hairbrush.
Yes.
A lot of times they're used to using medium bristles, sometimes hard bristles, and switching to an extra soft compact head toothbrush helps to reduce the risks of tissue trauma. It helps them to access for better cleaning, and it just keeps the whole process more comfortable for them. So if they do develop oral mucositis, which is like the inflammation or ulceration of the oral mucosa, the softer the brush that they use is going to keep it more comfortable that they can continue brushing, because the higher bacterial burden that they have in their mouth as far as plaque goes, it just starts that inflammatory process, and they're much more likely to have the ulcerations occur. So they get into a really vicious cycle with it. So we have them starting to use the extra soft compact head toothbrush, sometimes a post-surgical brush. We use toothpastes that are free of irritating detergents or other chemicals that can be irritating to tissue or dry the tissue out, avoiding using like xylitol products or something that can help to stimulate saliva while protecting against cavities, looking at the pH of certain products. So it's frightening to know how many dry mouth products there are out there that are actually acidic. So our patients that have dry mouth already have that acidic environment in their mouth. And so we want to keep those products up to that 7 or higher range to help balance that out a little bit. But a lot of the products that are acidic are just going to end up contributing to more damage to their teeth down the line.
Right. Yeah, you were saying that they have candy in the oncologist's offices for them to suck on. And I bet they do at home as well, because if you have dry mouth, we all get it at sometimes, but just imagine just having it so dry all the time that you're always sucking on something. I've heard of patients like go to bed with a lifesaver in their mouth to keep it moist. And
absolutely, or cough drops, things like that. They'll notice,
yes.
They feel like they're coughing more often because of things being so dry. And, they come back in after their treatments, and you think of all of the stress and the money and the time that they spend in the oncology department, that we want to avoid having them just transfer that to the dental office. And I think having 2 parents that went through cancer treatments as well, it makes me that much more cautious and aware of the financial stress that can go along with a cancer diagnosis. And that is something I think we do our patients a huge service when we keep that in mind for them, because let's face it, dentistry is expensive. We are very skilled and we get paid well for what we do, and rightfully so. But for somebody who's already struggling so badly financially, what can we do to help them avoid the problems and not just fix them once the problems are there?
Right. That's the last thing they need once they get better, hopefully, than to have to go to the dentist all the time, to have work on their mouth and to fix all the damage that could have been prevented. And so then they have to go to the dentist and spend even more money that they most likely don't have. That's
the emotional aspect of it.
Yes.
You think of I use my mom as an example. She, in the early 90s, she was only in her early 50s, and there wasn't even anything offered as far as reconstruction at the time after a mastectomy. So, she had no hair, she had no eyelashes, and the thought that she could lose teeth on top of it just seemed extra cruel. I actually had a patient one time who's a breast cancer survivor, and she was so nervous and anxious to come in for that first time after she completed her treatments. And she said, I was so afraid. She goes, because I kept telling myself, don't worry, your hair will grow back, but your teeth won't. And I think that really kind of summed it up, that, there's a lot of attention paid to people losing hair. It's amazing how a lot of foundations and different things, they will bend over backwards to help provide wigs or things like that, which, I don't want to minimize that by any means and the emotional effect that has on people. But their hair will grow back, and it's true that their teeth won't. We need to focus on those long-term effects, I think, a little bit more.
That's a really, really good point. And hair, yeah, hair's obviously you want to have your hair, not say anything bad about wigs and stuff. That's wonderful. But with your mouth conditions, it's an infection too. So yeah, that's really, really important to take care of that. Do you have, on that note, you said that your donations are dwindling or have been. Do you have a place where people could donate products or funds, or how could we help you?
Well, actually, what used to be my volunteer program, that's how it developed into Side Effect Support. So what I actually did is, rather than keeping it as a volunteer program or a nonprofit, I created it to be a business. And that way, I wanted to be self-sustaining. I didn't want it to be dependent on donations, because I found out how quickly that can change. and you're not guaranteed those donations. So I thought if I created a business out of it and I provide the products, that drives a revenue stream to help keep the availability of it there. So there are options. I do have not only full-size products, but I do have the pre-made kits in more modern versions now. And periodically I will have businesses or individuals that will pick an oncology department, and they would like to donate some. So they actually will purchase some of these kits, and then they will have it donated to the oncology center of their choice in their name. And it's really a nice thing for dental offices to do. It's a great community outreach. It's something that gets their name out there, and it gets exposure to even not only the patients and their family, but also to the oncology staff, the hospital staff that's working there, to show that you are going above and beyond for the people in your community who are dealing with a very stressful time in their life.
Right. Yeah, that makes total sense. So what kind of products do you have? So this is on your website,
Yes.
the sideeffectsupport.com?
Yep. I have a shop tab, and then it has some toothbrushes. It has different types of toothpaste. We have mouth rinses and a selection of oral moisturizers. We actually have like a selection of gums and mints and things like that, so they don't have to turn to the lemon drops and the cough drops and things like that. So we even have these toothbrush covers that help to protect the toothbrush from germs. So if you think of how people store their toothbrushes in their bathroom, and a lot of times they're exposed to airborne viruses, bacteria, anything that's kind of floating around in there, or they're storing them in a cup along with their family members and they touch each other. So something even like that, it's just that mindset of now that toothbrush can become a contamination source. If they're touching family members, that's one way that things can get passed from one to another. So it's a special type of toothbrush shield that covers up the brush to protect that. But I also recommend, if somebody's going through treatments, use your own tube of toothpaste. Every time you put that ribbon out, and if you touch the end of that tube, that can become contaminated and pass something from one member to the next. And I think we're all a little bit more aware of things like that with the COVID situation. But for people whose immune system is so compromised, that's just a great extra tool that you can do to protect them.
Yeah, those are some good points. I never really would have thought about that. Maybe because I always use my own toothpaste, but yeah, that's a good point. You're putting on somebody else's saliva. Yeah, and I think with the COVID too, people hopefully are aware of things that they've been passing along all these times that we need to be afraid of that as well. Yeah, I think that is absolutely wonderful that you provide those products and a list of, because people don't know. We think, because we know as dental professionals what's good for your mouth and what's not. We just assume that everybody knows, but
right,
they don't. So it's good they have a spot that they can go to find out what is recommended, and it's easy for them. Do you have like outreach programs? You were saying we could buy kits and then donate them to oncologists or to people that you might know that are that could use it. But what about connecting with medical doctors and oncologists to bring awareness to them of?
Yep. And part of Side Effect Support also is education. So it's not only the free online education that is available in our blogs and resources tabs, but then I also do presentations. So I'm able to provide PACE credits, and I can go do the dental continuing education. And I really like when we do a full office together, not only the clinical staff, but also the administrative staff, because Even though if an administrative person doesn't have any clinical knowledge, sometimes it might get a little overwhelming for learning all that information, but it's so important that they have that basic understanding, because that's where we tend to lose people. Is whoever is answering the phone, is who's scheduling appointments, confirming appointments, doing financial arrangements. That typically is going to be the first person in your office that finds out that you have a patient that is dealing with a cancer diagnosis. So if Mr. Smith has his crown scheduled and he calls up and cancels it because he just found out he has prostate cancer and he just doesn't want to deal with it right now, I think it's human nature that your first instinct is to say, oh my goodness, by all means, just call us back when you're feeling better. When that's a golden opportunity to say, Mr. Smith, let's take a look at this, make sure that he's up to date on his x-rays, make sure that he's not going into that with active decay, active infection. And then what can we do to arm him with all of these things that he needs ahead of time? And that is one aspect too, as far as like dealing with the medical and dental staff. There's access to prescription products on my site as well. So there's access to Saliva Max, which is a supersaturated calcium phosphate rinse for dry mouth and mouth sores. And then there's also access to an orthopedic script. So that is a non-opioid pain reliever, pain relieving gel, basically for oral wounds. So those are things too that it's not only that one-stop shop type of thing for the patient, but also for the providers as well.
Yeah. And I like how you said about the whole team being educated. It's so important. And I'm glad you brought that up, because so many doctors will go to these great CEs and they come back and they want their team to be excited, and you just can't give it to them as much as you could if you involved them and they heard it from themselves. Yeah. So when I started out at the front office, I was going to CEs like LVI. I'd go to LVI and sit through painting composites and matching up crowns and veneers. And I mean, I was the young receptionist answering the phone. I was like, I mean, this is good because I love to travel, but I'm like, why am I doing this? And then after a while, I caught on. I'm like, oh, okay, so I can answer the phone and I know what I'm talking about. It makes a huge difference.
Yes.
So in my mind, I know what the lab needs to be. I know all the stuff that you wouldn't think somebody would need to know, but if you want to be ahead of the game, that's your little secret right there.
Yes. And especially when somebody's diagnosed, they're on a time crunch most of the time, where it's, I always think having a cancer diagnosis is kind of like the hurry up and wait situation. So you rush in, you get that diagnosis, and then you usually don't see somebody, for maybe a week or two to find out what the treatment plan is. And then you maybe wait a week or two before the surgery. And then it's another wait between, that and starting the treatments or something like that. So there typically, and it's not the case for all cancers, but there's typically a little bit of a time lag in there where that's our window that we want to see them, but it's still a window of time. So we can't ever have what we're doing delay the start of that treatment. So we need to kind of work within that window, and especially having the administrative staff aware of that helps to not only aid in the patient communication, but also the scheduling impact, that we don't end up with a situation where now they need all of this dental work completed ahead of time, but they're scheduled to start treatments in 2 days. That can't happen.
Right. And then the admin team can help answer questions instead of playing phone tag or message tag with the doctor trying to get information. If they already know that information themselves, think, it's going to save so much time and precious time and for the patient to get their treatment done. And have to ask all those little questions that you could know. And so taking care of the patient, is number one. And the better you can do that, and the more you can provide for them. And having this information is so great. And these resources, like being able to share your website or get products for them is wonderful.
Yes. And I do have patient brochures also that are called Cancer Treatments and Oral Health. And it gives the very an overview basically of some side effects that they may encounter, and then the instructions of the ways of brushing differently or chemicals to avoid in their products and things like that. And if anybody needs those for their practice, I always encourage anybody to reach out to me. I'm happy to send you some. And that way you've got them on hand, that if you're in that situation, you have something to hand them and start with right away.
Right. How many times do we have a patient that will tell us that they're going into treatment or in treatment and they have questions, and we rattle off all these items and things to do for them, like soft brushes, Slabamax and stuff, but then they're not going to most likely remember it, especially if they are going through chemo. Or we write it down on a sticky, how professional is that? So to be able to give them a nice brochure that they could go home and have that information ready for them when they need it, that's great. And to think ahead of time to have it ready.
Yes, every brochure has a little discount code on there too. So if there's things that you recommend, you can direct them to it, but then it also provides them a discount. And that is one area where I think I probably am one of the worst business people in the world, because I am so cautious of their financial strains. I want to make everything as affordable as possible. My biggest concern is to get this in their hands, to get them started on it, and to provide the relief. And I think I just truly believe everything else will come back. As people find that relief, they will come back for more, and that will make it all work out in the end. But I do want people to have that ability to get a discount and get what they need.
Right. Yeah. There's a fine balance between business and morals and human kindness. I think you have to have it all to have it all, right?
Exactly.
So what kind of CE, what kind of education? You said you have some educational CE on your website as well that you provide?
I don't have anything recorded on my site, but I do provide the CE. So I can do presentations, and I can either do it in the practice for the whole office, or I will do it for either the dental side, or I'll do it for the medical side at all. So I can go into an oncology department and help to educate the nurse navigators. And of course, that isn't something that they necessarily would get credits for as far as something that I can provide, but it's very valuable for their patient care.
So are you a hygienist now? Are you still in clinical, or what is your career like these days?
I'm no longer working clinically. I am now also the community relations manager for Custom Dental Solutions. And that has been a really great opportunity for me. That is something that through Custom Dental, I can help to provide some of the education. And that is actually one place that you can find a recorded course is from the customdentalsolutions.com website. There is a tab that will lead you to recorded continuing education courses. And I do have one on there that gives an overview on oral care and oncology.
Okay, great. Yeah, so we can find some more information there. No, that was a lot of good information and really important information. So I was really glad for you to join us today, and definitely keep us updated if you have anything new comes out. We'd love to hear from you again, and keep everybody posted on any new and improved recommendations.
It's great. Thank you.
So I'm going to turn this off, but you can stay on.